COVID-19 has changed everything around us. It came to the U.S. on January 20th, then to Tennessee on March the 5th, and then on March 13th, it came to Chattanooga. On March 25th, Signal Centers closed all of our facilities, and on June 23rd, it came to the Signal Centers. Signal Centers has changed just about every element of our programs and services in order to keep people safe during this pandemic. Before entering Signal Centers facilities, a thumbs-up process must be fulfilled requiring masks, temperatures, and a validation of health along with an affirmative on 11 vital questions. We move fast to document and disseminate good health practices and to educate on the dangers of touch and the benefits of hygiene with aggressive hand-washing habits, as well as many other healthy habits to ensure safety. We also initiated facility changes to maximize existing heat and air equipment for the best possible airflow within facilities. All events and activities were canceled to avoid groups of people coming together. Meetings were stopped and replaced with technology-based meetings, and all staff were required to stop physically connecting with others and stop all travel. The wearing of masks by everybody, all of the time, except for in private areas, is continuously required, and we have much better success in having everyone wear masks than first expected. Everyone is reminded to stay home whenever there are any symptoms of illness that relate to COVID, and to stay away from others, but also stay home if they are exposed to someone who has COVID-19. Signal Centers has a comprehensive group of COVID-19 operational policies that impact every element of our programs and services and include a robust use of PPEs in a consistent fashion. Only necessary people are allowed in any of our facilities, and everyone must wear a mask and check their temperature, as well as the 11 questions thumbs-up process in order to enter a facility. Cleaning is a high priority for every person working in services, including toys and training items. Sanitizing efforts are intensified with high-use areas being continuously sanitized, and new tools like the electrostatic disinfectant guns being used routinely across service categories by numerous training professionals. But we can't celebrate because the environment is constantly changing and staff can easily become complacent. They are certainly not easy to do, but it's the only way to keep people safe. There are many excellent training clips on mask wearing. Let's take a minute to review this short clip from the NBC News.
And this morning, we're talking about masks and face covering. There's a lot of confusion about when to wear them, which kind, how to properly wear them, and how to clean them as well. NBC's investigative and consumer correspondent Vicki Wynn joins us now to clear things up. Vicki, you've been so smart on all this stuff. Let's do the top line first. When should we be wearing masks? You and I are inside right now. We are not wearing them. But when do you need to?
Well, the CDC's guidance on this is very clear. Anytime we are out in public, we should be covering our nose and our mouth. The intention behind this is to protect other people. The idea is we could be sick, we could be infected and asymptomatic, not showing any symptoms. So you wear a mask, you're protecting me. I wear a mask, I'm protecting you. It's especially important if you're going to be in an area where it's very difficult to socially distance, meaning a pharmacy or a grocery store.
Real quick, what if you're out running or exercising and you don't feel like you're around people and it's hard to do that with the mask? Can you skip the mask then?
This really depends. Are you going out into an open space just with people in your own household where you can guarantee 100% you're not going to come into contact with anyone else? Under those circumstances, sure, you can go out without a mask. But if you're going to a park or a hiking trail or walking along a path where you might run into another person walking their dog or going for a jog, you should have that mask on. Again, this is to protect other people, and it's very important that we all get on board and do this, especially now that it is the recommendation of the government. And in a lot of states, they're requiring this anytime you're out in public.
Okay, we know that the N95 mask, surgical mask, those are for our first responders. You can make your own at home, and I know you know how to do it, right?
Yes, Hoda and I did this a couple weeks ago, actually, following the guidance of the CDC. I brought it back in. It's basically a piece of rectangular fabric. You fold it into about thirds, put on these two little elastics on either side, fold it in like this, and then you're going to loop them over your ears. Basically, you could do this with a rubber band. The best kinds of fabric to use, high thread count cotton fabric. You want to make sure it's breathable, but if you can layer a couple of layers, that's going to give you more protection. You don't want it to be suffocating, though, and it's a good idea to have multiple masks on hand so you can change them out.
What about fit?
Okay, this is really important, Savannah. The masks, and we've seen all manner of people out and about wearing masks in all sorts of ways. We want to make it very clear. You need the mask to cover your nose and your mouth when you loop it over your ears. So I'm going to go ahead and do that with this cloth mask that a friend made for me. The idea is you want the mask to come up right beneath your eyes and then all the way to cover your chin. You want it to be comfortable so that you're not constantly fidgeting with it. And when you take it off, let's talk about that. You want to remove it from the back to the front. And when you get home, the first thing you should do is not take off your mask. You should be washing your hands first, then remove it from the back to the front. Don't touch the mask. Put it somewhere sunny because sunlight is a natural disinfectant. How often should you be washing the mask? Experts say it really depends. If you go out, you're wearing your mask, you go on a run, it gets wet or sweaty, you should wash the mask. Soap and water is fine. Throw it in the dryer. Make sure it doesn't shrink. If you're only wearing it for half an hour, you're going out to the produce stand, picking up some fruits and vegetables, coming back in, then you can probably go 2 to 3 uses before washing it.
I literally have 5 seconds. What do you do if your glasses fog up?
Okay, buy a commercial anti-fog spray or try this neat trick. Wash it in soap and water. Let it dry, air dry, without rinsing off the soap. There's supposed to be a small film that should keep the fog from coming out your glasses. Okay.
Physical distancing is probably one of the most difficult things we're doing if we're doing it correctly. But if we truly care about others, we will do this. Let's take a minute and review this short clip from Washington University on why physical distancing is so important.
Social distancing is our most important way to decrease the spread of COVID-19 right now. Social distancing means that we're avoiding getting together with large groups of people, and that when we are with people, we're maintaining at least 6 feet of separation in between the people. This is really important because COVID-19 is primarily spread through large droplets, and those travel a distance of between 3 and 6 feet and then settle down onto surfaces. COVID-19 can also start with really, really subtle signs and symptoms. It can really be hard to know whether you're having seasonal allergies, whether you're just tired from a long day, or whether you're in the early stages of infection. In addition, we're learning more and more from some of the nursing home outbreaks that people can actually be positive for COVID-19 before they have any symptoms. So if you keep 6 feet between you and other people, that is going to be the best way to decrease the spread of COVID-19. So when you're thinking about social distancing, it is really, really important to stay home. This is only going to work if everybody plays their part and sticks to it very, very strictly. And when you do go out, it's absolutely essential that you maintain 6 feet of separation between you and other people.
Please don't think you can go to a party, hang out with friends, and ignore best practices and not hurt people. This short clip from Dr. Fauci, the director of the National Institute of Allergy and Infectious Diseases, provides a poignant message to the importance of everyone remaining physically distant.
Together. And when people realize that, there may be more of a motivation of them to do that, that it's almost like your societal responsibility to not be part of the problem of propagating an outbreak, as opposed to saying, oh, I'm a young person, I don't care if I get infected. Doesn't make any difference. It does, because even if you don't get any symptoms and you're infected and don't know it, the chances are you're going to pass your infection onto someone else, who then pass it on to someone else, and then you'll pass it on to someone who could be someone's mother who's undergoing chemotherapy for cancer, or an immunodeficient child, or someone who has another condition, diabetes, very common condition. And then that person is at high risk for a bad outcome.
Thank you for caring about the people we serve and their families. And thank you for helping signal centers remain vigilant to best practices, especially during these difficult times.